Assalamualaikum. Today I would like to present about my case study. The title is Identification of Malarial Infection. In introduction, the patient is male, 40 years old. The patient complained of shivering and vomiting, have an elevated temperature at 39 degrees Celsius, have an increased rate of respiratory. He does not have any past medical condition, being admitted to hospital and undergoes a few tests such as full blood count, liver function test, and other tests to specify the condition. In early diagnosis, we can say that this patient may suffer from fever or viral infection due to the sign and symptoms shown by the patient. Next is laboratory finding. First is full blood count. This is being done to check if there is any abnormality in patient blood. Next is liver function test. This is being done to check if there is any abnormality of biochemical parameter, especially in liver of the patient. Next is malaria parasite antigen test. This is a rapid test to detect the malaria parasite antigen in patient blood. Fourth is blood film for malaria parasite. This is being done through microscopic examination to check for malaria species. Lastly is PCR for Plasmodium malaria differentiation panel. This is being done to detect and quantify through the DNA of the malarial species, which is Plasmodium vivax, Plasmodium falciparum, Plasmodium ovale, and Plasmodium malariae. In discussion, based on the lab diagnosis result, first, full blood count result show normal reading on most of the parameter except low platelet count at 87 microliter and low white blood cell count at 3.4 microliter per liter. Second is liver function test shows several abnormality, which is increased reading of total bilirubin, direct bilirubin, AST, ALT, alkaline phosphatase, and gamma GT. Third is malaria parasite antigen test kit result show positive detection of Plasmodium falciparum antigen towards the patient blood. Fourth is blood film for malaria parasite show species of Plasmodium falciparum were seen with the reading of 1622 per microliter of blood. Next, PCR for Plasmodium malaria differentiation panel show a positive detection of Plasmodium falciparum DNA in the patient blood sample. This result confirm that the patient blood containing Plasmodium falciparum species, as well as validify the result obtained through the blood film. This test is the most crucial test in confirmation of the disease, as this type of PCR is used for the detection and quantification of Plasmodium species with the extracted nucleic acid from the whole blood of human origin. All of the laboratory results obtained, most importantly with the confirmation test of PCR, conclude that this patient suffer from infection of malaria parasite. The full blood count test result were correctly identified, as a previous study showed that the patient with malaria infection suffered significantly low reading of platelet count and leukocyte count. Moreover, all of the parameters affected in the liver function test also correctly related with malaria infection, as previous study conclude that this infection highly likely to cause inflammation in the liver, thus resulting in significant increase of all those parameters. With the addition of other tests such as rapid test kit, blood film testing, and PCR for malaria infection, it increased the probability in diagnosing patient disease accurately without any error. Based on the diagnosis and the result, the doctor prescribed the patient with best treatment that will treat the disease as well as prevention that can be done to stay away from this disease. The treatment was anti-malarial drug resistant that used artemisinin-based combination therapy. It is to be consumed until the signs and symptoms stop showing. The way to prevent this infection was by avoiding the pathogen that caused the disease, which is Anopheles mosquito. Some of the way to avoid was insecticide-treated mosquito net, indoor spray insecticide, insecticide resistant. In conclusion, malaria infection adapted through the bite of Anopheles mosquito. All of parameter affected lead to evidence of malaria infection. Proper treatment also must be made, and the choice of drug are dependable on the species of Plasmodium because of the drug-resistant species. To conclude, early investigation and diagnosis play a vital role to detect early complications associated with acute or chronic malaria infection. Thank you.